All right, guys, what's going on? Happy to be here with you. Hopefully another healthy day for you. And we have a real treat. We're going to have a candid discussion with two frontline emergency room doctors who are in the thick of it. I personally really want to know what's going on, what's real, what's not, what's it like on the ground level, just what's the day-to-day look like right now. So without further ado, to make most use of our time, I'm going to introduce you to Dr. Villano, who's on screen. Off screen, by the way, respecting the 6 feet of social distancing rules that we're all going by, is Dr. Zelonis, and so here we are. So, Dr. Villano, how are you?
Fine, thanks. How are you?
Good, thank you. And I think everybody really wants to know, what's it like right now on the ground level? Like, if someone were to see what it looks like, in the emergency room right now, is it just like what they tell us about Italy, where people are flooding in and there's not even space for people, or are things in control? What's going on?
So what's going on right now, every city is kind of in a different situation. Right now, the ER is pretty well controlled. And the good news is that the people that really don't need to be there, for the most part, are staying away. But it's just an entirely different vibe. Even though the volume of patients is actually a little lower than usual, it's very, very tense. And everyone is super anxious. All of the providers, all of the patients, nobody wants to get coronavirus. So the tension and the amount of preparation time for each patient is taking so long that even though the volume is low, it's sort of compensating for it in a negative way, I would say.
So you said the volume of patients is actually lower than usual.
Correct.
Okay, well, that's really surprising, first of all, and great news. So, okay, so that's interesting. Are you seeing actual, have you seen an uptick in coronavirus patients coming through, or there hasn't been a tangible difference in what you're actually experiencing on the ground level versus, say, a week ago?
So there's definitely a tangible difference, and I can say that with certainty because I've been working almost every day for the past 2 weeks. And every hospital is seeing it and handling it a little bit differently. Our hospital is really only testing a select group of population. So even though I can't say that how many actually have coronavirus, we're seeing an uptake in patients with coronavirus-like symptoms. It increases by like 15 to 20 a day, the number of those people. So it's going up exponentially.
So, in your view, I mean, there's so much information out there, tons of misinformation. One of the things I definitely wanted to go through here with people is, I think a lot of people want to know, look, I'm hearing that vitamin C can solve this whole thing. I'm hearing that if I drink water every 15 minutes, I'm going to have a lower probability. I know that none of this is really completely proven through clinical trials or anything like that, but what do you recommend that people, they could be great preventive measures that we're all doing at home to try and stay away from this thing? And what is just one of those things that's driving you crazy that people are doing and they don't need to be doing and shouldn't be doing?
Okay. Well, I mean, the best thing you can do is really just personal hygiene and really just limiting the number of people and pathogens that you could get in contact with. All the extra stuff, like doing everything you can to keep yourself healthy, stay hydrated, exercise, etc. All those things that keep your immune system up now are going to continue to keep your immune system up. There's really no data, like you said, on coronavirus. And think about, let's talk about another thing, like a cold. Think about how sanitary you were before and how you still get colds because you're still out there in the world. So there really isn't, I don't know, do you have any?
Staying home and washing your hands.
Well, why don't we bring Dr. Zelonis on? And I'm not kicking you out, by the way.
No, we don't want to get too close. We're going to switch seats.
So, Doctor, I know that, and thanks for being with us. So, I know that a lot of people, including people I know, they're thinking about going to they're calling their doctor, they're wanting to get tested, or they're thinking about going to the ER. But a lot of them are being told to stay away. So there's in some respect really confusing messages, right? We're used to being ill and then heading to the doctor's office. What would you, as a medical practitioner, really like to see people do today to keep themselves safe and to keep others safe? Is it what we're hearing on TV, or is it something a little bit different?
That's a really great question, and I'm so happy that I get to help answer this. The majority of patients don't have severe symptoms with coronavirus. If you are one of the persons who have the cold, the nausea, abdominal pain, diarrhea, cough, fever, stay home. By going to your regular doctor's office, by coming to the emergency department, if your symptoms are not severe, you are just spreading the infection further. Stay home, quarantine at home. Please come to the emergency department when you are significantly short of breath, when your symptoms are worsening. But by staying home, by not infecting your general practitioner's office, by quarantining in your room, limiting the family members that see you, use your own bathroom if you have the ability to have more than one restroom, wash your hands frequently, stay home.
We also talk about that every time you come in,
And
you're having
Janice
to use
saying something.
PPE that they could be saving for someone sick.
Exactly. So when patients come in, keep in mind the vast majority, over 80% of patients have mild symptoms. When you come in, we are using a mask, a glove, eye protection, and our gown that we could be using on a patient who's more sick. And now that's one more PPE, which is the protective gear that I wear to protect myself, my family, but also protect all the other patients.
Yeah.
That's one set that is down, and there is a real shortage.
Is that our biggest challenge? Because what you just said
That is our
is
biggest challenge.
you're asking people to not think about themselves and not be selfish.
Correct.
But it's even unfair to call them selfish because we've lived our entire lives.
Yes.
It's okay that you're sick and you go and get help, right? And so all of a sudden, this thing that we're all used to doing is the wrong thing to do. And at least from my perspective, look, I'm sitting here. The room looks the same as it did before coronavirus, right? Like if I look outside, it looks the same as before coronavirus. So this invisible enemy, it's really challenging for me, and I think for a lot of people to understand what really is out there and why we have to have this more community-based line of thinking,
Right.
versus,
Yes.
on the lines of what you just said.
So, for example, if someone is at risk or we have a high suspicion that they have coronavirus, and for example, if they call 911, that ambulance is now out of commission in the county because they have to clean the rig. So there's a lot of issues, not just with personal protective equipment. For example, in the hospital, if I want to do a CT scan, CAT scan on a patient, that machine is down an hour and a half for deep cleaning. So there are so many ramifications with this invisible enemy, really, that people aren't thinking about. The particular hospital I'm at will be out of gloves in 3 days. No gloves.
What will you do in 3 days? So this is what I really
don't know
wanted
what
to
the
get.
plan is. And so
Okay.
we will be out of N95s in 12 days. The biggest thing I can say is if you have your own business where you have some of these supplies and you're not using them right now, or if you just have something stockpiled at home and you can share them with our local emergency departments, it will help us save other people's lives because we are seeing people very sick, needing intubated, needing the intensive care unit, and I need to be able to respond and help them, but also keep myself and all the other patients in the ER safe. I need gloves. I need masks.
This touches right on the next question I was going to ask you, which is, and let me figure out how to even articulate it, right? Because I know you and I know Dr. Villano personally. And so for me, thinking about, like, I realize you're real people, real human beings that also have your own lives and fears and everything else, just like the rest of us. And yet you have to go and perform with the prospect of maybe not having gloves or like, so how are you dealing with it personally? Like, how do you keep it together? Because you're dealing with,
I wouldn't say I am.
you're dealing with everyone, your own load, just like we all are, and everybody else's. Do you feel like the world's weight's on your shoulders? Like, what are you going through? And I don't mean you don't have to answer personally, but the medical, all the healthcare workers out there, the first responders, what are you all going through as human beings?
Thank you for asking that. Nobody really has been asking. I am very blessed to be in a community of doctors who we are on a group text chain. I love all the memes that are going on right now. Laughing is getting me through this, a little bit of wine at night. And honestly, just having other doctors and nurse friends to talk to about it, the people on the front line, we're seeing something that we can't explain or relate to other people except the people that are going through it with us. So, talking on the phone to Dr. Villano has been getting me through. Texting my friends has been getting me through. And developing relationships with patients who are sick and their gratitude. A lot of people have stepped up with acts of kindness in coronavirus that I haven't seen previously. I have friends who have been leaving little gifts at the door. I had a dear neighbor last night deliver a spicy margarita jar with a little note. I had another friend who made my family dinner when I was at work. Little acts of kindness.
So a lot of us know a first responder, a healthcare worker. Figure out one. If you can go and do anything like that for somebody today,
Please. Any
me too.
firefighter, any paramedic, any nurse, anyone who is on the front lines right now.
Now,
Just a small act of kindness for them.
and you and Dr. Villano, by the way, feel free to come in and out however you guys wish. There are some questions about. Thank you. There are some questions about. Well, let's see. Let's dispel some myths or some answers, and you may or may not even be able to answer these. Zinc. There's at least 3 or 4 comments here about zinc. Good.
So,
Who knows? What should we do?
So zinc falls into the category like vitamin C or like any other supplement that you can take for your health, that as long as you take it as it's supposed to be taken, probably can't hurt. Anything that you do to boost your immune system in this type of season can't hurt, but I can't say that if you go out and you kiss your neighbor, you're still going to get coronavirus, you know?
So my friend Lee Bergstein in New York, the American epicenter, right, for this whole crisis, is asking about the validity to the report that plasma of formerly infected people can be used to treat those currently ill. I suspect not anything that's fully fleshed out to where you could give an absolute affirmative answer, but what's just, do you feel like there could be something there, or have you read about this, seen this?
I've read about it a lot. I honestly don't know everything. That the problem is that this is new to everybody. So there's some data that they did on researching SARS that sort of relates to coronavirus because it's a very similar virus, but you don't even know if it translates. This is changing the subject a little, but I'll get back to it. After SARS, they created a vaccine. They were in the early stages of creating a vaccine. And that vaccine for SARS did create immunity so that if you got a little dose of SARS, that you could be immune to that virus. The new early stages I have read about the coronavirus vaccine is it could actually amplify your susceptibility to getting a severe disease, and they're having to work out those kinks. So unfortunately, a lot of the research from the previous very similar virus may not transfer to our current virus, and that is a problem that we're having. So all this stuff is anecdotal, and really you don't know who's going to get better and who's not going to get better. And so one of the things that's so cool is that the medical community is really coming together to do research, and our modern technology is amazing. And seeing what people have come up with in the past couple of weeks is one of the coolest things I've ever seen. But this is, again, just one of those things that they're going to have to test with this virus, and we don't know. We don't know yet. I don't know. Have you read anything else?
That was very well summed up. You
Okay.
could tell them the supplements that I'm on and that my family's taking.
Yeah, what are those? So Dr. Zelonis' family, I just overheard, is on some supplements. What do you?
So we are on vitamin C and vitamin D.
Okay.
And then I have a multivitamin that contains zinc. And then we have an elderberry sublingual liquid that we take as well.
And when you say you're on, go ahead, sorry.
Whether any of this works, I don't know, but those are all naturopathic supplements that are known to boost immunity, and I don't see the harm in taking them. There's no scientific data that it's going to treat the virus, but it will keep my immune system up so that when I'm exposed, maybe I have a better chance of fighting it.
And you just said, Dr. Zalonis, you just said when you are exposed. So you're expecting exposure at some point on just statistically speaking.
On two fronts. One, statistically speaking, as a general population, but two, in the emergency department, yes, I have a much higher likelihood of exposure.
I would say just one thing Dr. Zalonis said about the supplements. Don't take a whole bottle of vitamin C every day. Taking these things in excess does cause harm. Take them as you're supposed to take them, if you're going to take them.
Right. What I was going to ask that because there's reports of these heavy cocktails being given of vitamin C, and so people are taking 4, 5, 6, 7 times the recommended dosage. So you're not recommending that.
No, I'm not.
No.
People are asking, again, can you get it multiple times? I know the answer, and the answer is that we don't know, right? But I think the reason that people continue to ask the question is that whenever we see it being answered, say by Dr. Fauci on television, it's not an entirely straightforward answer because on one hand, it's kind of like a almost for sure not, but we don't know, maybe yes. Right? So how might you simplify that for people?
The only data that I can extrapolate this to is from the flu. And I would say most people I know don't get the flu more than once a season. But then every season, that virus mutates a little. And so you might get it again the next season. Very rarely we see people getting the flu twice in the same season, though it has happened. So they're not really that similar of a virus, but that's the only thing I can to extrapolate it. Is unlikely, but possible. But again,
quickly speaking of the flu, Sarah Halliburton is asking, if I or people I know were getting the flu, or what we thought might be flu-like symptoms, but I wasn't tested for the flu. I just sort of took care of myself. Might that have been coronavirus?
It might have been.
So Alicia is asking a really interesting question. We actually discussed this offline before we jumped on, and I found it fascinating. So with the shortage of medical supplies, protective gear, and so on, she's asking if there's a way to sanitize protective gear that was meant for one-time use and then use it again. Not necessarily asking if any particular, hospital or anything like that is doing it, but is there a way to do it that's being discussed perhaps?
Sure. So it depends on what the protective gear is. So like gloves, or some of those, like in the picture you sent out about this, there was like a plastic face shield I was wearing. There are wipes we can use to sanitize that stuff.
Okay.
For the mask, it's a little more difficult. There are some ozone machines that are saying that they can do it. You could, in theory, like hang it in your oven and turn it on a low heat for a period of time if you were willing to do that. There are some people that say you could put a mask in a paper bag for a week. None of it's really proven. If we become desperate, we'll have to do that stuff. But our hospital is doing everything they can to not have us have to do that. They're really trying for us.
So really quick, and we're going to close out here really soon. Thanks to both of you so much. Question I have is, so we're getting takeout and delivery, and we still have items from the outside delivered to inside, some of which are about to go right into our mouths. Nellie's asking, what if I pass someone in the market? Related to that, I'm asking, what if I go to the market and I buy some salami or whatever it is in a package, and then I'm holding the package, and then I open it and then I eat salami, right? So do we have to be sanitizing the packaging that our food comes in before we then go to eat the food? Is it to that extent?
Listen, there's no way to know who touched it before you, right? And they say that this virus can live for a couple days on plastic. So it's a little safer, I think, with paper. But I think in general, the plastic things, the safest way to be to wipe it down. There's no way to know how many people have touched a package. I personally, when I go to the store, I grab the first thing. And if I touched it, I'm buying it. I don't care if I even want it or not. I touched something by accident and I bought it. I don't know what everyone's doing. That's sort of this community-wide responsibility that we have. I'm wiping things down. Are you?
I'm also, when I am getting deliveries, I wash my hands. I take the bag, I put it in my kitchen sink. I take the bag down. I then wash my hands again and take the other contents out. After I've thrown away the bag, and the other contents that the food were in, I spray my sink down with bleach.
Okay, so I hope you heard that. By the way, you can rewatch this here on my Facebook page. That's great, and I'm going to share that with my wife and Nanny,
And
who
another helpful hint, whenever you come home from the store with your fruits and fresh vegetables, fill up your sink with water, pour in distilled white vinegar, and let that soak. Doing a 5-minute soak in vinegar water on your fruits and vegetables before putting them away is another good thing you can do.
So quickly here before we let out, are you at the hospital or just healthcare workers in general? Are you being prepped for an increase in the coming weeks,
We are
or
bracing for a monsoon.
you are?
We are. And the reason is because right now the coronavirus cases in San Diego are increasing by the day, and we're seeing that patients come more and more to the hospital with the symptoms. And what we've been reading is that the severe symptoms of coronavirus that would require hospitalization really don't happen on day 1. They happen more like day 7. And so a person may feel well for a few days, and then the severe symptoms are happening a little bit later. So if the number of cases is growing now, then we expect that in a week to 2 weeks, we're going to see a lot of really sick people.
Okay.
We are bracing for the worst.
I hope that a lot of this has helped people. I know that if I step outside, those clothes go immediately into the hamper, and then I put inside clothes on. Really, really helpful around what we could do with the food, what we could do to boost our immunity, our immune systems, regardless of if it's directly a corona, solution or not. That we all have to just make those efforts. Really, Jana, Dr. Villano, what are we really fighting for, though? Because at the end of the day, we're still being told that half of us are going to get it anyway. So is the fight really about buying time so that we get closer to the vaccine? Or is that what we're really kind of moving toward and fighting for?
It's all of it. It's buying time so we get closer to the vaccine. It's making it so that the whole community doesn't get exposed at once. And then in a week, the whole community doesn't show up to the ER so that there's enough doctors, nurses, techs, and staff to take care of you. Think about, if you look at these things about people sharing ventilators and all this stuff takes so much time. So I have personally had to intubate or put someone on a ventilator, a couple of patients that I thought may have had coronavirus. Normally, for me from the time I decide to intubate someone to the time it's done is a max of maybe 10, 15 minutes at the most. For me to intubate a coronavirus patient takes almost 45 minutes. Everyone in the room has to be in their full, protective equipment. We don't want to open the door too much. Everyone has to go in at the same time. We want to limit the number of staff that go in the room because you don't want to expose more people. The practices are different. So everything takes so long that if all of a sudden 25 people show up that need to be intubated, there's not enough doctors, nurses. The PPE is important too, but there's not enough people to take care of everyone if we all are sick at the same time.
And how about all the people that are just suffering from all of the other ailments, right, that exist in this world? So what advice do you have for them on who should be showing up for help when they typically might have, and what kind of help you might want to just put off and delay? And I think that's one of the biggest challenges is, I'd hate to break my leg, for example, in this time that we're living in, right? Because there's just implications far beyond the broken legs. So any comments on that? And then I'll just have one final question, and thank you both so much.
Sure. So what I'll say about that is somewhat vague, but basically come to the emergency room if you need emergency care. I know that there are some orthopedic clinics around that are seeing patients in their clinics to keep people out of the ER for this reason in terms of broken bones per se. If you needed to come to the ER before, come to the ER. If you needed to call an ambulance before, call an ambulance. Most people, let's say you think you have appendicitis. You don't usually call an ambulance for that. You drive in. Don't call an ambulance for something you don't need it for. Don't put off something that requires a doctor visit. But you don't necessarily have to come to the emergency room. All these local physicians that aren't necessarily seeing patients, a lot of them have opened up telehealth practices. They can screen you to kind of decide if your symptoms warrant emergency care or warrant an in-office visit. A lot of times in the past, people would come to the ER for things that did not need emergency care, like to be tested for mono or they think they could be anemic and they need a blood draw, but there's no reason to really believe they're anemic. A lot of that stuff can be taken off as an outpatient, can be taken up as an outpatient. Sorry, I got distracted by this awesome message by one of my dear friends on the screen. I can't hear you.
I'm sorry. My apologies. So lastly, there are so many people out there that are experiencing symptoms. I know some people personally experiencing symptoms such as tightness of chest, shortness of breath, likely in this thing. And they're told stay home. So which is fine. How do we know the moment where we should not any longer stay home? How do we know when we go from stay home to, okay, now my breath is too short or my chest is too tight? How do we know?
It's subjective, obviously. I mean, a lot of times what's really scary about the coronavirus, it's perpetuated this like mass anxiety. Everyone is just so anxious. And then they think, oh my God, I have coronavirus. And they start hyperventilating and then they start getting symptoms of hyperventilation, like tingling in their hands or whatever. What I would say is if you can get yourself to a calm place and you take a few deep breaths and you still are really having trouble breathing, then you need to go in. That's the biggest thing.
All right. Well, thank you so much for spending some time with us. I know it's valuable to people. We've had a lot of people on with us the entire time we've been here. So it's a service. And this is, I mean, talk about two American heroes. You're literally doing this on your off time when everything is already so heavy for you and you're about to head back. So it's endless help, endless effort. Thank you. And if at any point you feel like any of the information has evolved or there's something new that everybody should, I'd love to do it again. It looks like everyone else would love to as well. If you feel like there's just been development that would either validate or invalidate anything, you know, any of the questions that we all have. So get some rest and thanks again.
No problem. Thank you.
Dr. Zelenis, thank you so much as well.